welcoming all of you over here. And this is going to be a wonderful session once again. And I hope I will be able to satisfy the urge to learn at your end. So, the more you learn, the more you grow. So, be with me. And the we are on the journey of treating and we are on the mission of curing the sick, but we are with the gentle and speedy recovery, because homeopathy is not a slow science, but it is something which acts very fast. In organon of medicine, sir has said, after giving medicine, it takes hardly few seconds for the results to come up. In acute diseases, you can really interpret these cases, and you can find that these cases give you wonderful results, and you can see the results within minutes, and everything starts very easily. And you just have to be very observant, and you have to understand the signs and symptoms through which the recovery mode has to be tuned in. So, going ahead, taking blessings from our great master, Dr. Prafull Vijayakar sir, who has guided us and his soul journey, which was contributed towards homeopathy. And to my amazed friends, the more I go into the depth of materia medica in preparing these lectures, I really fall in love more and more deeply to homeopathy, and I can feel that the divine connection which the homeopathy can bring to you is really far than what ritualistic puja we do. Yes, it has got its own opinion, but if you really practice homeopathy to that extent, you will find the blessings coming to your doorstep. So we take blessings from our masters, and going ahead, another great master of his times and a stalwart of homeopathy, he himself tells ki it is such a perfect science, and which is based on the nature's law of cure, which is standing on the nature's law of cure, which has been true today and forever. But this divine science is partially being known to people. And really, friends, the more you read organon, the more you read materia medica, you will explore something new every time you read it. And every patient coming to your table will give you more better experiences of life, of materia medica, of repertory. So, going ahead, and aphorism number 16. Today, I would like to bring you in front that when you talk about vital force to anyone, in our days when we used to talk about vital force, we were like bounced back by people saying that, where do you find this vital force in your body? Can you explain it through experiments? Because science believes in experiment, and science believes not on philosophy or on the myths and talks what you have. Can you feel that this is where the vital force exists? So when Hahnemann sir, in Hahnemann sir's day, I don't know how much advancement he must have faced or adverse situations he must have faced. But in today's world, when we are facing every new challenge, new cases, we come to know ki yes, this is where homeopathy stands, and this is where we can define homeopathy and can understand the depth of knowledge of homeopathy. So, when we talk about something invisible, we talk about the dynamic forces, we talk about the influences on the body, we talk about those adverse influences on the body which disrupt or disturb the harmony of our physical body. So, as we all know, we have got a multiple. Sector where we have a karmic body, which we can see as your physical body, and we have energy body and energy planes. And as you all know, I have already taken this in the Koshak theory. I will take it future may or detail may, because new dimensions have been discovered which I can understand and correlate with the cases. So when we talk about something which is dynamic, which is invisible, which cannot be measured through the weight, but the effects can be seen. So when we are talking about these effects on the dynamic plane, on the physical body. We are talking about all the correlations what we make in today's world. What we called is the emotional pathology. When we talk about someone, like I'll give you an example in this aphorism number 16 I have taken before also. Again I will take this aphorism, but because you can correlate it more deeper and deeper and deeper, because aphorism number 16 talks about is that when you are affected, it is not something which has hit you materially, it is not something which has just entered inside your body, but there is some disruption, there is some imbalance which has brought up in the physiology of your body, and that brings about the pathology. I'll give an example. Exactly when someone scolds you, when someone screams over you, when someone insults you or shouts upon you, exactly the words are only being transferred. The energy of that person, that negative energy is being transferred to you at this physical plane. Actually there is no exchange of material level. You never say कि उसने गाली दी तो it was packed in a gift wrap packet and I just carried it and that was being gifted to me in a material form. But all those abuses, those insults, those emotional turmoils, even the feeling of being loved, happiness, every emotion what you feel in this dynamic world is something which is, the effects can be seen on your physical plane. When such small emotions, if I scold you, if I scream you, if I shout upon you, if I insult you, you can see that over a period of time, your face will change, your expressions change, you start feeling dull, you start feeling low, and you might get effects. Even fevers do come up. You have an example of chamomilla where just the mother expresses anger upon the child and the child goes into that anger pranks, goes into that phase of colic and abdominal pain. So when these emotions can bring so much of complaints at this physical level, so this is being perceived through the senses, through the nerve endings which are present all over the body, and these nerve endings which are nothing but the communication between the outer and the inner world, because outer world and inner world needs to be connected through these sentient nerves, and these nerves, when they receive the signal, yes, this is the signal of being loved, of being cared, and when this signal is being received, the body goes into the phase of growth phase, or the body goes into the shift of parasympathetic nervous system, where the body relaxes, you feel calm down. When you are around people who love you, you feel so secure, you feel being enjoying life. And on the contrary, when someone is with animosity, these nerves which are present, they experience these adverse situation, and the body reacts to these adverse situation, giving you lot of diseases. So when anyone talks about aphorism number 16, talks about vital force, I will say कि vital force is nothing but the homeostasis which is being well maintained in the body through the positive and negative feedback mechanism, and everything, the connection between the outer and the inner world is through these nerve endings, the sensitivity of the patient which gets hit, which get hurt. And the symptoms what we see is in the form of totality of symptom, and through these totality of symptom we can understand ki internally what has happened. You cannot just peep inside someone's heart and say कि this person is deeply hurt, or this fellow is angry, or this fellow is in joy, but the expression what comes up at the physical level and the emotional level, they can be sensed by us, and you can understand कि yes re baba, this person is really not feeling well, or this person was being loved, so he is in a cheerful phase, in the phase of growth, in the phase of lot of energy and dynamicity. So this aphorism number 16 is, I will say, is somewhere the soul of whole understanding of organon of medicine. And what Hahnemann sir has to say, that as we all are physicians who want to give a complete cure to these patients, and we cannot understand the internal alterations which are happening inside the body without they are being reflected on the physical plane through the signs and symptoms. And you are a true physician, or you are a true healer of the signs only when you understand these signs and symptoms, and you are able to give a perfect cure when you give importance to the whole totality of symptom and the morbid derangement whatever has been brought up, the signs and symptoms which are just shouting and screaming ki yes, there is something which is being disrupted inside my body, and I need that help. I need that help so that I can live for my higher purposes, and I want to enjoy every life zone. So when this feeling comes up, so this is responsibility of the physician to give complete cure and annihilate everything which is there internally and externally, and so that the totality of symptom, the totality, the disease itself can be completely cured. So this aphorism number 17, when you talk about aphorism number 16, you talk about aphorism number 17, it is the complete package of you to understand what Hahnemann sir has to tell you as a true physician. What is your moral duty, or what is your responsibility, is to understand whatever changes which are happening inside the body, which can be perceptible through the nerves, and they are expressed at the external part of the body through the signs and symptoms. So it becomes our duty not to prescribe on some specific symptoms or some partial symptom. You cannot give a palliative treatment or something suppressive mode, but you have to give is a curative treatment, and this cure is only affected when you are following the Hering's law of cure, when you are able to bring back the internally changed alterations at the vital principles to which the disease has been expressed. So the process, again, when he talks, Hahnemann sir is very methodical, and I like the way he has presented in the whole aphorisms. Aphorism number 5, aphorism number 202, when you talk about a complete package of understanding the disease, you have to understand the totality of symptom. You need to prescribe on the basis of totality of symptom. At this time, you have to understand the disposition of the person, the family background, the stresses, the social position, everything in a totality. You cannot say that this is a doctor, so you cannot take him for the granted कि अरे doctor's life is always stressful. No, you cannot do. You have to understand how this person is working, how the person has evolved right from the childhood till now, what consequences, what adverse situation this person has been facing day in and day out, and how we need to handle it. So that complete totality can be judged only when you are treating the patient and ascertaining that you have taken a complete picture right from beginning, from relationship, his domestic relationship to his social responsibilities, and how this person has been evolving. So aphorism number 202, definitely he encourages you is for the hard work. And yes, one more thing, what Kane sir has introduced is that our will, our understanding, and everything, whatever we have been talking about, we are talking about the spiritual science, we are talking about the spiritual sickness, and we are talking about how the sora has been developed and how the disease progresses from sora to psychosis to syphilis. And if you have to understand the journey of the patient, you have to understand the journey of the disease. Not only that, but you have to understand the miasmatic evolution also which has taken place in this individual. And Kane says that nothing is possible unless and until your internal body, your internal soul participates or corresponds or reacts to the whole situation. Only then it is possible that you get affected from these diseases. And the most important part of the totality is the will and understanding. Because if I will to participate, I will. When there is a will, there is a way. Similarly, the body speaks. When there is a will, there is a way. You have to understand the complete internal state of the personality of the individual. Only environment can never be the sole cause for the disease, unless and until there is a two-way reaction. When the internal environment allows that external environment to sow the seed, only then the tree can prop up, only then the emotions can affect you. If my sensitivity is not for the insult, whoever, whatever behave in whatever way, I will not be affected by this, truly. But yes, if my sensitivity is there for rudeness, someone even looking at me will affect me. So definitely environment plays a role, but environment alone cannot affect anything unless and until your internal body also supports. And these man's affections are nothing but the sensitivities of these individual. I hope I'm damn clear, because this is again a repetition what we have taken in the previous ways, previous lectures. Repetition, but all something very new. The most important part of the understanding of emotional pathology, people talk to me that predictive homeopathy is really very difficult to understand sometime, and why we need to explore the emotions of the patient so deeply, why we need to understand at this level what are the vital forces changes, what and how it is affecting. So aphorism number 16, when you talked about that vital forces being affected, the emotion, the will, the understanding, the morals, they all play a very important role. So everything starts through this imagination. The person perceives the things, the person grasps the thing, person receives whatever is being given to them, and the way they reciprocate, they give back, they react to these imagination. Example, I will take a very small example to explain this aphorism. This is a very beautiful example. uh, Today I was in a bad mood. Okay. Example. Since morning, I must be struggling as a housewife, as a mother. The child who must be suffering with cold coryza, and I was in that pissed off phase. So, if my husband is not ready to help me, so what does the wife says or wife feels? He is least bothered of anything, and he doesn't give due respect. The person is not giving importance to the family, and he's not a good husband, he's not a good father, he doesn't understand importance of everything. And this imagination, listen, matlab, there is only one incidence where the lady has not even seeked help from husband. She has not even asked the husband ki really I need some help, the child is really bothering me and I need your help. Without any clarification of the thoughts, she is just into that imagination zone, that from this small incidents only she will go to the level of ki my husband doesn't loves me, because he doesn't care about me, he doesn't bothers if I'm sick, I'm not feeling well, I have a bad day, and the child is really troubling. So this small imagination can lead to lot many more imagination, and finally at the end of the day, when it's the time for the husband to reach from the office, the mother or the mother would have had expressed her anger on the child, must have beaten the child badly, she would just knock herself with severe headaches, not feeling well, uneasy, nausea, vomiting, because of all the imaginations she has brought up into her zones. So these imaginations are nothing but the emotions which they hit you. This is not an empty speculation, but they are also the delusions, the false belief system what we have, or somewhere the fixity of emotions what we have. I will take this in again in the case that you will clear this point more. I hope I'm very clear. If any question, you can ask me at this end, because this aphorism is really very important to understand the role of emotional pathology and the connection between pathophysiology and emotions. What is I'm going to take ahead. Anyone wants to ask something? Okay. So, as we all know that we have a conscious mind and we have an unconscious mind or the subconscious mind. But in our daily life, the conscious mind is just 10% which is working, but the subconscious mind which is working for 90%. So, this subconscious mind is not something which is built up in one day or two. You cannot say कि yesterday I had an incident and today I have registered it to the subconscious level, but this has been building up since you are born. This has been building up from the long term experiences throughout your life and the belief system that you have been brought up. Like if you are brought up in certain community, you will have your own rituals, you will have your own understanding of the society, you will look into things in a different perspective. And when you are understanding the case, you have to go into depth and understand the perspective with which this person is talking, with which how this subconscious mind can be entered is only through a complete process of understanding dream, physical generals, totality of symptom, emotions, will, moral, intellect. When you completely take a case, you completely understand how the person is solving the life hustles and puzzles. Then you progress towards understanding the complete personality or the constitution, so that you reach to a correct genetic constitutional simulum or to the GCS, because it both compares and confirms is contains conscious and subconscious mind both. So we are made up of will, emotions and intellect. So as I told, key the intellectual part is something through our thinking process, the reasoning, how we know things, how we perceive things. But what we feel about it and how we react to it depends on the will and the emotional aspect. So when you're deciding a constitutional, you need to understand all these three components of a person. So it is being clearly mentioned by Sigmund Freud. Freud. He was a great scientist, a psychoanalyst who has worked a lot of on the subconscious mind, and a lot of theories has been generated by him. And he clearly mentions that emotions, if you just resolve them, if you express them, if you accept them, the stress will not be a stress. But if you are not able to resolve, if you are not able to express these emotions, they will never die. These emotions, they just get more uglier, 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 and they get more deeper, deeper, deeper. They are pushed layer by layer, layer by layer to the subconscious mind, and these long term memories, they let you hold grudges, create negativity for the person, or hold on something animosity towards a person, and you land up into some strained relationship, and these emotions gradually become permanent memory in your body, and they become develop permanent nerve cells, which in return the emotions what we have felt affect the cellular pathology or the cell or the physical body, and they are expressed in the form of disease, which is more uglier ways of the disease. So I would like to take the case ahead. So this is a case of a female who came to me along with her mother. She was a very beautiful looking girl, fair complexion, good heighted, a Mona Punjabi person, and she looked very beautiful, dressed elegantly in jeans and top. But the appearance she had was very well dressed. All every time her hair are well set. She is presentable and not talking much in the first meeting. So she came to us. Now there is an exercise which I want you all to do is and actively participate. The exercise will be that whatever symptoms I'm trying to read out, we need to connect it at the physical level. So today the function and the structure, the cellular level and the pathology we are going to match, and the bridge will be the emotions what the person has suffered. So first part I will only be taking is only the chief complaint. So please pay attention and start writing down and actively participate in this so that you get more and more questions and I will be able to solve it. So she's an 80-year female who has come to us with irregular menses. Her menses had not appeared since 6 months, and last time, whenever she had her menses, they were only single day flow, and there was continue spotting. And she says that there is continuous spotting till now when she had come to us, and over a period of time, she says ki whenever I exert, I do exercises, my this spotting problem gets aggravated, and I don't feel happy, and there are a lot of mood swings and mood changes which are going during these menstrual irregularities. She said ki I started my menses in 7th standard. That was I got my menses slightly earlier than my friends, and till 11th standard, that is far back, 1 year or 2 years back, everything was going very good. But suddenly I feel that in this 2 years of time I have developed lot of facial hair, and there is lot of leukorrhea which is constantly there. And also I've observed that my weight is continuously increasing, and almost that weight gain is from 54, that is 20 kg weight gain, to 74. There are no acne, there are more of facial hair. There is sleeplessness. She says that since throughout the day I have to sit on the chair, or I am only into studies, I am not a person who has been working so hard. So probably because of that, I don't get tired and I cannot sleep. Otherwise, I feel very lethargic, no desire to get up. I feel very unrefreshing, and that is what she said. So she was more concerned, and she consulted us was for her irregular menses. So can anyone try and unlock the mind of this PCOD patient? Definitely, this is PCOD. Again, one more ahead step is the investigations. So, to tell you that she had a good hemoglobin level, slightly higher side were her total counts, and there was no other symptoms. Stretch marks are there, and one more thing is that her cholesterol level, that is total cholesterol, is slightly increased. Her triglycerides not very high, but on the borderline. Her thyroid has been absolutely normal, but her AMH, that is anti-Mullerian hormone, is increased, that is 6.4. It is supposed to be not higher than 4 and 5. The FSH and LH ratio is okay, and prolactin is absolutely normal, but her serum insulin level is increased, that is 7.25. So this is the complete body. What I am trying to tell you is, now please understand that body will never lie, and there is a complete connection between mind and body. So, can anyone participate and let me know that what did you understand through these symptoms and signs? What are being expressed in this patient? So, when you're talking about the mind and body correlation, you need to understand the complete physiology of a female which is going on. So, when we talk about pathophysiology, when we talk about physiology, we talk about normal anatomy and normal physiology. So, we need to understand the femininity and balance between mind and body, which the body tries to maintain in within us. So, this mind and body correlation becomes very important part of our study, and we need to understand ki how we have evolved and how the femininity has evolved, and right starting from the balance between the masculinity and the femininity, how it maintains the harmonious balance, so that we as females can enjoy the femininity and the masculine part, the males can enjoy the masculinity, but we have got the both energies within us. We have got the nari, nar and nari shakti, what we say, they both are the part of the energies of Shiva. That is what we say, we have studied. So this was being well known to our science, to us, way back thousands of years ago, that there has to be a balance between the dark forces and the light forces, so that the earth is in balance. So similarly in our body, there is a force which is acting as a masculine power and energy which is acting as a feminine energy. We being females, our feminine energies are slightly higher because we have female hormones which are dominating over the body. In males, the male androgens or the male energies or the male hormones are dominating, and therefore they enjoy the masculine powers of this universe. So we all know that we have got a normal menstrual cycle, and this normal menstrual cycle is working through a feedback mechanism where the higher centers of our existence, that is the pituitary gland, which plays a very important role by secreting the releasing hormones or the gonadotropic releasing hormone, which is very effective and which is the most important organ hormone involved for the whole menstrual cascade or the cycle, what we say, the whole menstrual cycle. We all know that we have got an endometrial phase where we understand ki how the follicle is growing, and equally how the endometrium of the uterine lining is also growing. So when there is a surge of these follicle stimulating hormones which are coming from the higher centers, or the gonadotropic hormone which stimulates and secretes the follicle stimulating hormone, releasing FSH and LH, which brings upon the ovulation of the ovum. What happens during ovulation? That in our whole lifetime, it is being divided that how many menstrual cycle or how many ovulation cycle we will have in our whole lifetime. Every month when we reach our menarche, after that one ovum is supposed to get matured. That oocyte has to mature and oocyte is released. That is called the process of ovulation, and every month that happens, and over a period of time, this graphene follicle, or sorry, this follicle that uh, matures to form a corpus luteum, and there is a surge of progesterone and estrogen which brings about the endometrium, which is responsible for the growth of the fetus and providing nutrition. And similarly, as the follicular phase advances and the luteal phase comes up, the endometrium also grows. So we need to understand this perfectly, how the physiology of our body is. We also have to understand that androgens which are present, the hormones which are present in the body, they play a very important role in this maturation of the endometrium in the process of ovulation. And if the mother conceives, or if the female conceives, then the role is important for giving birth. So as you all know, the structure is being developed according to the need of the person. So this, the uterus which is there, the need of the uterus is to carry the embryo and mature it to a completely grown fetus ready to get delivered, and has to give lot of nourishment, lot of energy, lot of food to all these growth factors. So how this grows, we all know. I will not go into further details because we all have studied physiology. So we know that in our body there is a balance between the male energy forces and the female energy forces, and this balance has to be maintained so that there is no disruption. For one more surprise, you all know that there has never been a strategy from the universe that there is only a male giving birth. Equal females are also getting birth on this planet. So there is some energy which is maintaining the balance between femininity and the masculinity. You cannot imbalance, or you cannot decide कि what birth you need to give. It will be a male child or a female child. Everything is being perfectly planned by the mother nature to maintain the harmony of this universe, and the basic harmonious balance is between the male and the female part. Similarly, inside our body also there is masculine energy and feminine energy. So it becomes very important for us to maintain this Shakti and Shiva energy within us. We have both the hormones which are present, but the masculine energy is something, that energy which is responsible for protecting us and caring for us. We know that fatherly figure is there to protect you, to support you, to earn a livelihood for you. But equally, the feminine energy on the other side is more for giving nurture through the womb, right from the womb to lactation to future in the life. So there is lot of masculine qualities which we have, that is logic, there is lot of reasoning, there is lot of moving activity, obstinacy, that is firmness and determination. There is a strong instinct of survival, loyal towards the partner or loyal towards the universe. They are more adventurous, lot of rational thinking and strength. The power, the masculine power of males is very strong, whereas when we talk about female, the femininity, they are more of intuitive, they are more of love giving, caring, healing, gentle, wise and emotional, but they are flexible. So, in our case, as we have seen, what has happened in our patient, that there is some disruption which is happening at the hormonal level. So, what are the thoughts which are making this patient feel sick? What are the thoughts at the vibrational level? What frequencies this child must have attracted? Why the person is suffering? Always ask the question that why the person is suffering. What are we made up of? Are we only emotions, or are we only frequencies at the physical plane, or we are more than that? Are we just effects of the emotions, or we are attracting all the negative thoughts also? So whatever we are results of the emotions what we have generated through the ages of our life, and the frequency on which we are vibrating at our intellectual level, at the thought level. So definitely, we are attracting everything according to our thoughts and the feelings, and your body is an absolute mirror of your mind. As you worry, your body shows it. As you love, your body shows it. As you are overwhelmed, your body will show it. As you are angry, your body will show it. Every cell of your body is being allowed or resisted by the way you feel. My physical state is a direct reflection of how I feel. Instead of how I feel is a direct reflection of my physical state. So whatever is there on the body is direct reflection of whatever is there in the mind. So in our patient, what we see is the reflection at the physical level. So, before that, let us understand how this physiology has been working in this female. So, according to the case, now we understand कि there is some hormonal imbalances. As per se, we can see that her AMH, that is anti-Mullerian hormone, is on the higher side. Her menstrual cycle is disrupted. There are polycystic ovaries, and also we can see that there is lot of hirsutism or lot of changes at the physical level. She's gaining weight, she's putting on weight. So if there can you say that this is a normal body? No, this is absolutely not a normal body. At the age of 18, she needs to enjoy the life of being feminine. She has to grow as a beautiful female with good figure, rather than going towards an ugly looking face with lot of hair growth, bloating sensation, stretch marks. This is not what the man is made up of. So here you can see that there is an androgen imbalance or a hormonal imbalance. The testosterone level is getting disrupted, and the estrogen or the progesterone cycle is also being disturbed, and therefore she is not able to bleed. There is lot of spotting, there is amenorrhea. She's supposed to be a female, her body is supposed to be feminine, so she must have a normal menstrual cycle every month. Every month, that is what our body is made up of. There is a circadian rhythm which is continuously working, and according to that, every month we should have normal menstrual cycle. But what has happened in this case, all her hormones are getting disturbed, the lipid profile is getting disturbed, her insulin level has gone up. So what must have happened? Now let us try to understand and unlock each and every symptom. So definitely we can understand that this person is not in a good state of health. So these are androgens or the hormones, when they are at the optimum level, at the optimum level, you will understand the antral growth or the follicular growth is perfect. The follicles, they grow to the optimum size, and they end the whole process with an ovulation, and the primary oocyte which matures, and the cycle of life continues. And if the pregnancy is there, then this life cycle continues to giving birth to a new life and a new energy. So understand, this optimum level of androgen is so important, and if these androgens are on the excessive plane or they are excessive, what will happen? The follicular recruitment will increase. Rather than one oocyte which has to mature, there will be lot of more premature follicles which will come into play. But the follicles, because they don't have proper environment, they don't have proper emotions, they fail to grow, and they reduce the quality of the ovums, and the ovulation doesn't hamper, and each oocyte which is supposed to grow and mature, it just gets blocked at this phase, and there is no proper development, and leading to a polycystic ovaries. and therefore the ovulation which has to occur and the corpus luteum which has to form, leading to corpus albicans or to the zygote formation. But what happens? Everything is disrupted, everything fails at this primordial level, and therefore the oocyte, they fail to open up. Now, please understand what happens inside our body when these hormones are getting disturbed. So, what you see in our patient also, there is lot of mood changes, there is sleep problem. You will find further in the case, yes, the thought process is also getting disturbed. The digestion is weak. There is lot of anxiety, depression, headaches, vaginal dryness. The libido goes down because the androgens are not properly released. There is stubbornness in the mind level and also at the level of acne. The acne, they progress from stage 1 to stage 3. Cystic acne, they will come. There is specific food craving for something which is not good for the body, and they tend to eat more when they are in that stressful phase. And there is continuous fatigue, lethargy, no desire to wake up. There is weight gain, there is hormonal hot flushes, the breast size do changes. And definitely, since the androgens, they directly affect the cortisol level, the stress which affects the cortisol level, this androgen will affect the immunity also, affecting the macrocyte, and therefore they will have a low immune system, frequently falling sick. In every second female today, you will find that they don't have that energy, that strength, that power. My nanny would perform much better, my mother can work much better than what today I can work. And I can see my next generation that they have very low capacity to work, they don't actually work what we can have, the physical stamina what we have, the disease stamina fighting what we have, they are hit by small diseases. This would never happen to us. So these androgen, they play and they spoil so many factors in the body, leading to the symptoms of weight gain, menstrual complaints, PCOD, mood swings, abnormal hair growth, thinning and thickening of skin. There is abnormal baldness or male like baldness because the hormones are getting increased. There is fatigue and tiredness, and there definitely there is sexual dysfunction and infertility as a consequences, and they fail to enjoy the femininity, they become more like masculine. So, pathophysiology, this is very beautifully explained. Please understand each and every symptom, how it is getting unlocked, and then in the case, try to find out ki these are the reasons which has played a vital role in developing the symptoms in this patient. Okay, so when you talk about these hormonal imbalances, when you talk about something which has stressful being there in the environment, which affects the hypothalamus, pituitary, and way back the autonomic nervous system, which takes this stress as there. And when the body responds to this stress, what happens? The androgens, they get disrupted, and this androgen goes and directly affects the FSH and LH ratio. Exactly what happens is, in PCOD, when you understand the oocyte or the ovum, if I have taken, yeah, I have taken it ahead. That actually there is no problem initially with the LH and FSH ratio. If you take many cases, please understand these clinical pathologies, because every case of PCOD don't just skip without investigating. Please understand, go for investigation of testosterone, insulin, the sugar levels, LHFSH, the prolactin, the AMH, everything has to be considered along with the lipid profile. Because when the person lands up into hyperandrogenism, or when the androgens they increase in the body, they really disturb the whole cycle. And initially, the ovum, there is some rigidity or there is some obstinacy where the ovum, they get the stimulus from the higher center, and there is some rigidity at the ovarian level. Because there is some rigidity at the ovarian level, in spite of the surge of LH and FSH which takes place during the 14th day of your menstrual cycle, normally the ovaries, they are so obstinate and they become so stubborn at the primordial level that they fail to mature, and those immature kiddish and uh, they go for not responding to that surge of LH and FSH, and gradually what happens is this ratio gets disrupted and body gets a signal, there is some problem at the ovarian level. The body cannot understand, and because of lot of the irregularity, there is lot of LH, that is luteinizing hormone, which gets surged. I have to hit, I have to hit, I have to hit. The body fails to understand that there is some problem at the ovarian level. Body feels ki maybe the signal what I am passing through, or the neurotransmitters or the hormones which I am releasing are inefficient, and before because of that the LH, it goes to high level. There is surge of LH ratio, and gradually the follicle stimulating hormone goes down, and the ovary fails to ovulate or to mature. And also a very beautiful understanding you should have is of how these hyperandrogens, I told you ki this FSH goes down and LH increases, and this leads to a cycle which is called as anovulatory cycle. You will see in many cases of infertility coming to you that there is a follicle which is developing. There is multiple follicles which are arranged in the periphery of the ovary like the pearl drops, but these follicles, they don't ovulate, and because they are not ovulating, the follicle stimulating hormone that goes down, and the progesterone which is supposed to be there, which has to be secreted, it goes again, it is not being secreted in a proper way, and again there is a stress which is going on. The luteinizing hormone again goes to the higher level, and the estrogen level or the estradiol goes up, leading to scanty menses, leading to only spotting or menses bleeding only for a day or even half day. Even the patients will come to you and tell you that I did not bleed, only there was a spotting which remained for 10 days, 15 days, 5 days, but there was no proper flow. There was no, absolutely no proper flow, because of this LH surge, because of this follicle stimulating hormone going down and the estrogen level going up. The endometrium lining may be proper, or even endometrium can be thickened, but the ovaries, they fail to respond to the stimulus, and this ovarian failure responding, not responding to LH surge or to FSH, will lead to oligomenorrhea. So this is there in our patient, right? The patient has complained of scanty menses or menses only with spotting, which is still continued till now. So the reason behind is androgens, right? So this hyperandrogenemia, what will happen now when these androgens are very higher in your body? There is a very beautiful cascade which is being also explained, that you must have seen that these ladies, they put up lot of weight. So why this lot of weight is there? Because of again this hyperandrogenism, or the cortisol level which are going high, the metabolism which is getting disrupted, and because of the adiposity, adipose tissues which get deposited, the adiponectin hormone which is supposed to be there, which allows this insulin to enter the adipose tissue, and there is a neogenesis, or the glucose cycle which is there, has to be there. But because of this lot of adipose deposition and less of adiponectin, this insulin resistance happens. and you will see these patients, they gradually go on putting lot of weight, and therefore in PCOD cases, the importance, the second symptom what our patient showed was weight gain, right? The first symptom was irregular menses, the second symptom was weight gain, and there is continuous weight gain which is going on. So these abnormal levels of gonadotropin hormone leading to hyperinsulinemia, and this hyperinsulinemia is not the primary dysfunction at the pancreas. You will see pancreas absolutely normal. Only in the reports you will find that in this patient also what we saw was serum insulin level is on the higher level, or the lipid profile is disrupted. So this is because of less of adiponectin hormone which is supposed to be there, and there is insulin resistance which is there at the periphery, and therefore you have seen in today all the gynecs, they are promoting, rather than giving hormonal treatment to these patients of PCOD, they have started giving metformin as a tablet to these patients. Have you all observed this? Have you all seen the prescription? And they are more promoted to go for weight loss. Why metformin is given? The reason is because metformin acts on the peripheral tissue and reduces this insulin resistance, so that the adipose tissue utilizes the insulin, and the pressure which is building up as a negative feedback mechanism goes down, and hyperandrogenism which is there as a resultant is somewhere the pressure is going down. So it is must, as if that the child or the person who is coming to you is promoted to go for exercise and go for walk. Some theories say in today's world ki PCOD doesn't need to be treated, only thing you require is to advise them lot of exercise and dietary restriction, where the dairy products and white sugar has to be avoided. So this is the correlation that now our patient is also showing is insulin level which is very high.